The decision not to publish this report against the backdrop of the Black Lives Matter protests has been hugely controversial. It's caused anger and upset amongst BAME communities. Remember, this report was supposed to make recommendations about how to protect those communities from their increased risk from COVID-19. It's been raised in the Commons several times, and when the Equalities Minister was asked about it, she stood up and said, "We put a black professor in charge of this review." Well, critics have said there's no point doing that if you're then going to ignore all the work that he did. Kemi Bangkok also said that Public Health England didn't make recommendations because they weren't able to do so. But tonight, Channel 4 News has seen those recommendations. Labour has been hugely critical of the statements that the Minister made in the Commons, and they've written to Matt Hancock tonight, Dawn Butler has, asking him if those statements can be corrected. We've been reporting on this story for many weeks now, John, and we were originally told that everything that should have been published was. But tonight we've been told that the full report will finally be published next week. But here's our report tonight on what it includes. These are the recommendations that the government chose not to publish. At the start of the pandemic, when it became apparent that Black, Asian and minority ethnic communities were being unequally affected by COVID, the government ordered a review. Recommendations were made by Professor Kevin Fenton, who engaged with thousands of people from BAME communities across the country. And what they consistently told him was that the issue of structural racism had a huge part to play. Tonight, Channel 4 News has seen the proposals that he made in his 69-page report, a report that has still not been published. It recommends that comprehensive data on ethnicity must be collected to help mitigate the impact of COVID-19 on the BAME community. It calls for more research into the social, cultural, structural and other determinants on the spread of the virus amongst ethnic minority groups. And it calls for culturally competent risk assessment tools and prevention campaigns. Crucially, Professor Fenton concluded that his sessions had found, without explicit consideration of ethnicity, racism and structural disadvantage in our responses to COVID-19 and to health inequalities, there is a risk of partial understanding of the processes that produce poor health outcomes. Paulette Hamilton is one of those who took part in Professor Fenton's engagement sessions. She told us of her reaction to the recommendations and the anger felt in the community when they weren't published.
They were angry, they were hurt, they felt yet again they were not heard after 1,000 organisations being contacted and asked to take part. I believe they felt that if they left it out, people would make a little bit of noise for a while, but they would go away. But it isn't going to happen because many people have died and we want answers, and it just cannot keep being that if the word racism is mentioned, people run for the hills.
The decision not to publish was raised in Parliament, and critics have described the report that was published without Professor Fenton's contribution as a whitewash. Tonight, Public Health England told us that the important engagement work Professor Fenton carried out will now be taken forward by the Equalities Minister.
We're joined now by Dr. Kailash Chand, who is a former Deputy Chair of the British Medical Association. Dr. Chand, it isn't as if the whole issue of BAME deaths in the NHS as a result of working at the front line in the virus treatment wasn't controversial enough. Now there's a report and it has no recommendation, and the man who was leading it didn't issue the report. What are we to make of it?
Thank you, John. Allow me first to congratulate Channel 4 for exposing the doublespeak of this government. Do something, say something. That's what they've been doing all along. As far as this report is concerned, it's a total shambles. Betrayal of BAME communities, which have given their lives, as you very rightly say, to save so many lives. And if we don't act on these recommendations, I think more lives will be lost. Truth is, John, coronavirus is not racist, but it has definitely exposed the structural and systemic racism in the NHS. A person like me who has worked in NHS for 40 years have seen this gradual or this continuous racism in the system. And we've been asking and pleading to the government to actually look into it and sort this racism out once for all. John, there are about 277 trusts in this country. And would you believe it? There are only 7 CEOs in that 277 trust. 44% of doctors who actually run this NHS are essentially from the BAME communities. 1 in 5 NHS workers is from BAME communities. So what is this government doing? Just shedding crocodile tears, or perhaps clapping at 10 Downing Street and not taking any action to really improve things for us?
Clearly something has gone wrong. I mean, the man put in charge, Professor Fenton, in some way played no part in the end in the publication of the report, and the report had no conclusions other than the sort of broad brush stuff that we've already reported. I mean, this was not a normal inquiry, and yet it was an issue which had really been right at the top of the whole interests of the country.
Absolutely spot on, John. The truth is, even when this inquiry was set up, there was, as you know, there was so much hue and cry. 90% of doctors who died were from BAME communities. 34% of BAME community actually was in intensive care. So they wanted to do something to show that we are actually very concerned about it. But the truth came when they actually amputated the real part of this report. What we need is so many reports have come, John.
Let's just try and see what...
Also, you must have seen it. But the truth is, unless those recommendations are acted upon, nothing would ever change.
Well,
I
Dr.
think it's
Chan,
still high time. It is a good opportunity for this government to really consider Fenton's recommendations and implement immediately so that we can save many lives.
But, Dr. Chand, have you had any contact with Professor Fenton? Is it possible to work out what has happened, why he did not report his own inquiry?
No, I have not any personal contact with Fenton, but what I've heard is that I think this whole atmosphere of what has happened in America with George Floyd's death, it was, what I hear, was apprehension that it might perhaps, the racial tension might come up much more, and they wanted to avoid that, which is not the fair thing.
Dr. Chand, I'm very grateful to you for coming on. Thank you very much indeed for talking to us. Thank you.
Pleasure, John.
Now, testing and tracing is at the heart of the drive to beat the coronavirus, and today the government published the first official data on how the system is working in England. So, how's it going? Well, officials admitted that it is not gold standard yet, but the Health Secretary insisted it was having a huge impact. The figures show that in the first week of the operation, only a fraction of the likely cases were spoken to by tracers. Our political editor, Gary Gibbon, reports.
Across England, the easing of the lockdown is moving up a gear. Shops in Guildford today preparing for opening on Monday. At the heart of the government's plans, a tracing operation that can dampen down new outbreaks of COVID-19 by focusing lockdowns on those with the infection and those they may have been in contact with.
If you test positive, NHS Test and Trace will contact you to trace people you might have infected.
Today, the government published the first figures on how that tracing operation is going.
The system is working well at scale. We are reaching the majority of people testing positive, and you are trusting in us, providing us with your contacts and isolating when asked. We will keep learning, improving and refining, but I'm confident that together we are building a high-quality service on which all of us can depend.
Of the 8,000 people who tested positive for COVID and were referred to the tracing operation, we're told that 2/3 of them coughed up their recent contacts, people they might have given COVID to. But we think the 8,000 figure is probably a bit low for the total number of positive tests, so not all of them were referred to the operation, and we don't know how many of those contacts were then communicated with quickly, within 24 hours, say. What we can say is that we probably don't have a tracing operation as good as the one Boris Johnson said we'd have by now.
We have a growing confidence that we will have a test, track and trace operation that will be world-beating, and yes, it will be in place. It will be in place by June the 1st.
He promised that we will have a world-class system, and we will. We clearly are building and improving all of the time, and we've been incredibly frank about the fact that this system is going to get better and better, and you can see that it's started in a pretty good shape.
Tracers working in the call centres are finding, on average, with much lockdown still in place, those who've tested positive don't have many contacts to pass on.
When you bring up the contacts, the people they've been close to who have no symptoms and haven't tested, and you tell them to lock themselves in for 14 days.
Yeah.
What do they say?
The majority of people I've spoke to, they're a friend of that person, so they know because they've probably had the news that the friend's unwell or has tested positive. And again, the majority of people that I've spoke to were already isolating.
There's still no official word on when we will see the app, trialled on the Isle of Wight, rolled out nationally. It can play a special role tracking down people you've been close to without knowing their name. The government is now downplaying its role as the cherry on the cake, not a central part of the plans for easing lockdown.
Gary Gibbon. Well, joining me now is Sir Chris Ham, a specialist in health policy, a former chief executive of the health think tank, the King's Fund. The way the government described it today, you'd think they were doing very well because they talked about reaching 85% of contacts. But the total number of people they're dealing with still seems to be a small fraction of the actual likely cases. So how would you say this is going?
The accurate thing to say is the government has made a start, but there's an awful lot more work to do to build anything approaching a world-beating or a world-class test and trace system. And that's because the government lost valuable time back in March when the lockdown was introduced. They should have started immediately and involved local government, which is where all the expertise rests in directors of public health and environmental health services. And they didn't do that. Only late in the day did they recognise the contribution that councils could make. And in fact, only yesterday did they allocate the extra funding that's being committed to councils to enable them to do the work. So I think we need to be realistic about the claims that are being made and recognise it'll be some time before there's a fully effective system working for us.
The independent SAGE group set up by Sir David King, the former chief scientific advisor, has just said that this isn't hitting 75% of cases. So it's way off where it needs to be. Would you say that's about right?
As far as we know, yes, it's still early days. I'd like to see the numbers behind that claim. But what we need to do is recognise that as we move into the next phase of combating COVID-19, we're likely to see local flare-ups, local outbreaks, rather than a national set of challenges for health and social care. And that's why the local element led by our councils and public health teams is so important, because they understand their communities. They need the data about the number of cases in their area, whether they're increasing or decreasing, and they can then intervene. It might be, say, in a school or a care home or a hospital, and use that local knowledge to help contain and hopefully eliminate those local outbreaks.
So do you think, like other experts have suggested, like Anthony Costello, that GPs should be part of this process?
Yes, GPs should be part of this process, and my understanding is, as yet, test results, positive test results, are not being reported back to GPs, which seems a significant omission, given again the knowledge they have, not of their patients, not only of their patients, but of the communities they're serving. We need to have a fully integrated system of GPs, councils working together with local testing capacity that's convenient. And above all, we need rapid turnaround of test results, which hasn't happened so far, because you have to move very quickly once you know somebody's tested positive to feed that information through to the local contact tracers so they can do their detective work, identify people who've been in contact, and then support them to isolate. Some of those pieces are coming into place, but it'll be some time yet before we have a fully effective system that will give us the confidence we all need.
What about the app? We were once told it was game-changing and it was going to be our civic duty to download it. Now we're told it's just the cherry on the cake. And the cake's only sort of half there.
This is another example of what I think has been a bit of a pattern in our response to the pandemic, which is English exceptionalism, choosing to go with our own NHS-designed app rather than using one of the ones that's already in use in the other countries like South Korea or Germany that have demonstrated much more success than we have. So I believe it's much more important to think about the people doing this work, testing, tracing, speaking to people who've been in contact, reassuring them, having the conversations that will support them to self-isolate, and then supporting them when they're at home with all the things that they will need to do that successfully. This is about people on the ground, the army of contact tracers that have been referred to, and they're the ones in local government that we now need to look to. The app will supplement what they do. It's no substitute.
There are people all over the country who are saying to their friends and family, I think I've had it. But we don't have an antibody testing system up and running for the general population yet. How important is that? I mean, would it be a sort of a false sense of security?
It could be a false sense of security. I believe at this stage, the antibody test is less important than the testing as to whether people do have the virus, and then the contact tracing that follows on from that. All the evidence from around the world, countries that have been much more effective, is you have to test, as the WHO has said. You have to have really effective, smart contact tracing, that detective work. You need to have the local intelligence. What public health directors will want to see is a picture of their community, the pattern of infection, the rise or decline in the number of cases in their area, to give them an early warning sign. And the mayors of Manchester and Liverpool have made this point repeatedly, that we are moving towards a future of local outbreaks. And looking at the R number across a region is helpful, but within regions are varies from area to area. And it's identifying the areas where there are particular problems that is the key in the next stage.
Sir Chris Ham, thank you very much indeed.
A report by a group representing social service directors across England has found nearly a quarter of them believe the majority of coronavirus cases are in care homes are the result of rapid discharges of patients from hospital. The survey, which received responses from 146 local authorities, also highlights concerns that people were potentially discharged untested to care homes that had insufficient protective equipment. Our North of England correspondent Claire Fallon has this report.
Every number is a person, a life lost, with a ripple effect of more lives that are changed. But the scale of loss has not been felt equally. And now there's further evidence of the impact on social care. As the report says, decisions about priorities, about where should get the greatest protection, have had tragic consequences.
We're talking about lives here. That's ultimately what we're looking at.
Nicola runs 3 care homes in Sheffield. This one hasn't had any cases of COVID-19, but at the other 2, the virus spread quickly and claimed lives.
We can't ignore that we were not afforded the same protection as the NHS. I think we're all looking back and thinking, why have we been put in this position?
So when you hear Matt Hancock talking about his protective ring that he threw around care homes and saying that they've invested and saying that there's this 600 million, what do you think?
I think that they are deluded as to how it's actually been on the front line.
A report published this evening is based on information from directors of adult social services in almost every part of England. Most of them said for a period of time, patients were being discharged from hospital into care homes without being tested. Some of them said they believed that was the reason behind the majority of infections in care homes in their area. And it was at a time when some care homes were struggling to get PPE. It paints a picture of care homes where they were under-resourced and ill-prepared.
I think if I was to leave a message for government, national government, it's please talk to us before you implement something.
And has that been the pattern, that things are announced without conversations being had beforehand?
Yes.
That must be frustrating.
It is. And we make the best of it. But sometimes, 24 hours to have that conversation might just have ended up with a better plan.
More people being protected.
Yeah, we all have the same aims and objectives.
The government says adult social care will continue to get the support and resources needed. But many care providers have told us 600 million announced last month is all but unusable. And today's report warns some care homes may soon close.
We need support and we need the government to step in and rescue the sector.
That's how stark things are at the moment.
Absolutely. And I think as providers it feels immoral of us to be facing such decisions like making redundancies and potentially closures of homes, residents having to leave homes because the funding is just not there.